Let's talk about the two different types of procedures we have available at Northwestern Hair. This is number 2 on our quote sheet, and it's coming number 2 because it's right after graft count in terms of its importance. Now, at Northwestern Hair, we have 2 different procedures. We have our standard FUE, Follicular Unit Extraction, which you're used to seeing in the community, although it does have some added touches that we've created over the years to refine the procedure and make it better overall. And then we also have our micro PUE, that's minimally invasive collection by reticular oscillation using vibration to do PUE versus FUE, pilosebaceous unit extraction. This is when we're actually not focused just on the follicle like they are in follicular unit extraction. We're actually focused on the entire hair unit, which involves the hair glands, the tissue surrounding the hair shaft, and part of the muscle attachment to create a much more natural hair once it's extracted, to create a much more natural result. So you're going to pick between these 2 procedures after you choose upon your graft count. And you'll see there's a lot of features between these procedures that are the same. It's the same team. Me, Lyda, and Delia are your Northwestern team. We'll be performing either one of these depending on what you choose. They also include the timeless hairline design. Now, if I was going to say what's most important, you got graft count, and then you got timeless hairline design or hair design in general. This is a technique that we developed over the years to make sure that your results look good for years to come. We actually ignore the hair that currently exists on your scalp, and we actually map out what your future hair loss is going to look like. And once we have that foundation, we actually build your hair restoration on top of that. And we look at it from all different directions, from front, side, back. And we make sure that someone who's walking around you, that over time, they're going to see a nice foundation of hairs that we laid down and not something that's going to cut off too early or extend too far forward. It's just going to have a nice proportional look from all angles that's going to last into the future. Lastly, part of that is actually making those lines that are part of the future cross into the present, such that when we design a hairline and we know the recession is not going to be the temples here, but behind the ear, we want this line to flow through, cross through the current naturally, and then flow into the future in the back. That's what we call the timeless hairline design. It is extremely important. This is part of your procedure that cannot be reversed if done incorrectly, and it's included in both procedures. So you can see from the design aspect, you're not going to lose out on that. Also, our no-touch technique. This is simple. When I first started hair restoration procedures, I saw technicians manhandle the grafts. Like, hey, that's a very delicate piece of tissue. It's just a hair strand and tissue around it and a follicle and oil gland. Every time you touch it, you can crush it. So stop touching it. And that's what led to the no-touch technique, where we try to get these grafts out without touching them, or if we're touching them very delicately, such that the hairs are never injured. But now moving on to real difference here. Micro PUE, I have a more detailed video on it in the item itself. This is where we use vibration to remove the hairs instead of cutting. When you use cutting, you're following the hair shaft down and you're cutting everything in the path to get to the follicle. Whatever's in its way, the oil gland, the tissues, is going to get cut off. And about 12 to 15% of the time, you'll see something called a transition. Something's going to get lost and it's going to lead to a hair that's dead, dry, or kinky. Well, with micro, where you're vibrating the hairs out or using multi-phase extraction, the mode that changes its way it removes hairs as it's going down the hair shaft to remove the perfect graft every time. Those transition rates drop well below 2% in our practice, leading to much more natural hairs. More dense results, everything you imagine that goes with it, less injury. But watch that video on micro if you're interested. You see a scalp preparation. This is actually when we actually say, hey, is the skin healthy that we're transplanting the hairs into? If it's not, can we prep it? Can we increase the vascularity? Can we make these hairs take faster? Can we make them grow faster to greater density? That preparation phase in it. And then also ACS graft stimulation, again, using the same principles of the skin preparation to actually, when the hairs are ready to grow, making sure they have the blood supply from the scalp, because the hair will never grow thicker than its blood supply allows. So when these hairs are ready to grow after the procedure, we want to essentially give them the best shot possible growing. So in standard FUE, you get the team, you get the hairline design, you get no touch technique, because there's no cost added to that. If you're doing micro, you're definitely kicking it up a notch. You're getting the healthiest, most natural hairs, most natural results. We're priming the skin to make sure this procedure goes as best as possible, and then we're stimulating the growth of the hairs to make it better. And you can see there's a pretty big cost difference between these procedures. These 2 procedures would benefit everybody who does them. So choosing here is really important. You'll see a next step down, which is additional recommendations. These are tailored techniques. These are ones that are specific to people and they may not apply to everyone. When you're choosing a procedure at this level, this is applied to everybody. Anyone can benefit from a better result from micro, but obviously there's a cost benefit analysis you have to perform.